because you are part of the co-chair of the Native Hawaiian Caucus, I wanted to obviously give a chance to talk about some of the issues. Obviously, so many issues. DHHL always a constant issue. Trying to get that list down,
Right.
get people into homes. Maybe give us an update on what kind of priorities are out there.
Sure. In 2022, the Native Hawaiian Caucus backed, at the time, Representative Sylvia Luke's proposal to appropriate $600 million for development of housing for the Department of Hawaiian Homelands. The big challenge from then to now was whether that department even had the capacity to spend all that money before, from a budget standpoint, it lapses back. There's a deadline to spend money that's budgeted, taxpayer money that's budgeted. And so we were, I think, really happy to see that they are on schedule to get those dollars out the door, which will turn into housing units for beneficiaries on the Hawaiian Homes wait list. And so I think that helps everybody, because those same people are in the housing market right now competing with everybody else for apartments or home sales. And so when you get folks off the wait list, they're in housing, they're no longer competing with everyone else for housing units. Going forward, we got to have a conversation about, okay, now that they've shown that they can move the funds out the door and they can build, they have been one of the largest developers of housing over the last 20 years. How do we keep going? How do we attack the wait list and get people off and fulfill that was the condition of statehood. We were allowed to become a state and get a star on the flag because the state agreed to take on the responsibility of the Hawaiian Homelands program, which was a federal program at the time. We have lots of other conversations we're having right now. I think there are going to be some exciting, developments that I'm going to be proud of having the Hawaiian Caucus and Hawaiian legislators involved in. We're almost there. I don't think it would be appropriate to announce them before we actually have agreement on it. But there's, there are a lot of issues, and people often assume Hawaiians all get along and see things the same way. And they're just like everybody else in the community. There's differing opinions, and we're spread out everywhere across the state. That's right. And so some of the issues that matter in one corner of, one island don't necessarily matter as significantly as for folks in others. So we're working on it. We should have some interesting stuff soon.
Little teaser for us there. We have to look out for that. But I know at least one thing that we have been following or talking about is the negotiating of military land leases. So are you encouraged by some of the discussions around that right now? Because at least we don't have the deadline of, have this deal or done by, well, now it's passed, but now we have more time.
Well, and I think that's the most encouraging thing, is that there was this specter of, will the federal government sort of come off the top rope on us and intervene in a process that's, this renewal process is required by state law. And it's to lease state lands, right? That's the thing I think everybody should remember we should start at, is these are state lands involved, and an entity is coming in to ask permission to lease them. Hey, we have a legal process to do that. The Army has committed to follow that process. And then when things went awry and their environmental impact statement wasn't accepted, then we started hearing these questions about whether they should, just assert federal law and dismiss our state process. There's a time period, and the time period has now been extended because the federal government has basically said we won't do it without congressional support. So I think it gives everybody involved the opportunity to take a breath, and we can start having conversations about whether we're going to proceed as we were before, or whether there needs to be some other way of working out an agreement that everyone in the community can feel comfortable with. Of course, to do with an accelerated process, with
Yes,
specter
the
of
pressure.
condemnation. Right.
Do you see an opportunity to reclaim some of that for DHHL lands?
Potentially. I think the governor was right to convene an advisory committee of Native Hawaiians to just start a dialogue. So now I think it's important that we have the dialogue. And I have always said that as a legislator from Oahu, the Big Island should lead the way on a Big Island issue. This has significant statewide implication, and some of the conversations have been around land swaps for highly contested areas on Oahu, like Makua. But ultimately, this is a site on the Big Island. And so we should make sure that those folks are the ones that we're going to talk with first. I thought the convening of the advisory committee of Native Hawaiians to have a dialogue that the governor did was the right move. And that's really how this is going to go going forward if we're going to do it the right way.
Well, and definitely this is another issue that we're following and wanting to.
Yeah.
3 years is not very long.
Right. And this is a really significant issue. You know, you basically can't keep forward troops in Hawaii unless you have a large combat training area. And so, it stimulates a lot of discussions with everything that's happening nationally and the Trump administration talking about Greenland and Venezuela and Cuba and Ukraine and all of this. Well, Hawaii is the headquarters for the United States Indo-Pacific Command, which is the Indian Ocean and everywhere in the Pacific. Are we still going to maintain our military posture in the Pacific, or is there going to be some drastic change in policy like we're seeing everywhere else? If I think we need some certainty on that as a part of this discussion. And ultimately, everyone in the state should be a part of it. I just think, you should start in the communities that are the most directly. Yeah.
Yeah.
I am on Hawaiian Affairs.
Hawaiian Affairs, which one? And the
Health and Human Services, which is
Oh.
going to be a huge issue for us. Okay, when that big, ugly bill was passed in Congress last year with the tax cuts, they also included really significant healthcare changes that are going to result in cuts. So we need to do a lot at the state level to upgrade how we manage Medicaid programs. But the projections are that 50,000 people are expected to lose their health insurance in Hawaii because of the new requirements put forward by that bill. So we have to try and hold ourselves accountable and catch up to the new expectations as effectively as possible. And we got to do that stuff right now. The Trump administration awarded $188 million to the state for basically to phase us off of that Medicaid spend. Those are one-time funds that we have to try and use in rural areas to boost up our system as much as possible to deal with the long-term impact, which is the loss of 50,000 people's health insurance.
Yeah, that doesn't sound like a lot.
So, I mean, you can argue the politics of it, but those are the facts. We have huge challenges to try and figure out how to accommodate the loss of insurance for those people. And we got to make sure that we upgrade our system and use the money that we're being given this one time the most effectively. We have great healthcare outcomes in Hawaii, but the difference between, the statistic I heard the other day is that the difference in life expectancy from one end of H1 on Oahu to the other end is 10 years.
Interesting. Who did that research?
It's 10 years. That's the State Health Planning Development Agency. And so for the west side of Oahu to have a life expectancy that is 10 years shorter than the east side of Oahu is just dramatic and very frustrating for people that live over there. And so we have this opportunity with these one-time funds to shore up the system the best we can, knowing that in the long term, most of the cuts and the damage is going to happen to those same communities that are struggling. So that's the challenge in Hawaii. We have great systems and coverage, but the results are so dramatically different for different communities, even on one island, that there's a lot there that we need to fix. There's going to be a lot of pressure. Absolutely.
Yeah, access continue. And even though, like you mentioned, that the possibility is there, just getting the access to those resources is such a struggle for folk.
Right. The easiest example is if you're on Medicaid coverage, it's hard to get a doctor. If you have gold standard private insurance, it's just a lot easier. If you can't get a doctor, then it's hard to get a specialist and to eventually get the procedure or the device you need. And that's how it sort of manifests.
The recent, I think they got rid of the GET for the private practitioners, right? The medical practice. That's a benefit, right?
Oh,
That's health.
it's a huge benefit. Medicaid and TRICARE
Yeah.
is military coverage, and so that makes it that much. It makes it significantly cheaper for doctors to
To see more
see
patients.
more patients. Yeah, especially primary care, which is your basic doctor you go see. So we're hoping and we think, because we've had this dialogue with the doctors, that it's going to ease their costs and make it easier for them to take on more patients. And so how do we leverage the money that we're getting now? How do we plan for the future cuts that we know are coming? And so that we can make the whole system work better. It's a huge challenge, and so it's one of the big areas of focus that we're gonna work on this year.
Yeah, and this is kind of off topic, but I wanted to get your sense since you mentioned you're part of the health committee. What about the HMSA merger with HPH? Are you getting feedback from your constituents about
Oh,
what are you hearing? What are you thinking?
a lot of people are very concerned.
Yeah.
Sadly, it's a big change between two very large organizations, so I think the concern is warranted. I think we there are a lot of details that we still need to see. There are potentially some avenues for there are potentially some state processes that they're going to need to go through to get approval, but for the most part, these are two large private entities that have decided to engage in a partnership. Affiliations is what they called it. If it turns into a merger, then there's a federal process through the DOJ. I'm concerned about the transparency and the credibility of DOJ processes at the moment. But I think it is our responsibility at the state level to seek answers and details. We were short on a lot of that, but we started the initial conversation. And I think the most telling thing, and it's going to require us to pay very close attention, is how adamant the other healthcare players in the community were in opposition to this. So, until we see something concrete, it's difficult to figure out whether it's going to impact communities in a good or a bad way. But the initial sentiment has been pretty concerning.
Yeah, I think in an age when we're already worrying about costs and then any big change like this, fundamental change, I think a lot of people, and we've been hearing it too in the newsroom, just people just worried, what's happening? What does this mean?
Right.
So,
Right. And Hawaii is unique. You can't, if you don't like your coverage or you don't like your doctor, oftentimes you're pretty short on options, and you can't, when things go really bad in the system you're in, you can't just drive 12 hours to another state where go to hospital and then deal with it afterward. Can't do that. You can't put grandma on a plane.
yeah.
California, if they're really sick here, you are where you are. So cost is a significant issue for everyone. I mean, they have lost a lot of money over the last several years. The significant question that we're gonna dig into is why, and why does this, fix that concern? Nobody likes their insurance costs growing out.
I don't think I've ever heard anyone say that their insurance costs are great.
That's right. So how is this going to make things cheaper?
Yeah.
Right. And why is this way the way?
Yeah.
So we're going to keep working on it.
All right. Well, Senator Jarrett Keohokalole, thank you for joining us today. Such a great discussion. So many different topics that we got to cover. And good luck to not just today, but throughout the session.
Thanks so much. It's an exciting time. I mean, it's exciting to be in on the important stuff, but there's a lot of pressure. So we got work to do.
And we'll be watching you closely. Thank you again. All right. And I'm Annalisa Burgos for Hawaiian News Now. We'll see you next time.